This is one of the most critical issues facing the state of Missouri right now and many other states. It's no secret that I don't like Obamacare. I said at the time that Obamacare was a disaster, and I understated the situation at the time because we didn't really know how bad it was. As Nancy Pelosi said, you're going to have to read, you're going to have to pass a bill to read it. And once they passed it, people started reading it. And one of the things we found out was that Obamacare is killing our health care safety net, ours and that of states across the nation. For Missouri, one of the most devastating impacts from Obamacare, beyond the insurance policies you said you'd be able to keep and you can't, the doctors you said you'd be able to keep and you can't, is the devastating impact it will have on healthcare providers for uncompensated, or what we used to call charity care. If Missouri doesn't act to address these coming cuts, I'm concerned that hospitals in rural and inner city communities will be forced to make dramatic cuts in their services, and in some cases close their doors. And something I think that is one of our most vital parts of the safety net, our community health centers, are being devastated across the state. In some areas they've had to shut completely. And this is where we need to be able to send people for their primary health care. Those assets are being lost. It's a serious threat to the healthcare safety net, particularly in rural communities where care is already scarce. Rural hospitals in Missouri, which already lost $28 million in 2013, are facing cuts of approximately $58 million this year, with increases in cuts coming each additional year, reaching $208 million per year by 2019. That's why we're seeing hospitals like hospital in my hometown of Mexico, hospitals in Nevada, West Plains, and throughout the state are laying off workers. We've seen some of our best doctors leave to go to other states, which are not facing cuts like this. But it's not just rural communities. Overall, Missouri healthcare providers will lose around $3 billion in federal funds and cuts that have already started, which is why earlier this year, Connect Care in St. Louis, which provides health care for the poor in St. Louis region, had to close their doors. I've talked with the head of Truman Hospital in Kansas City, which is the basic safety net hospital there. They are right up against the cliff. To combat the Obamacare creating threat to our health care safety net, our state needs to pass a Missouri solution. We need a common sense, show me state solution that reforms Medicaid, takes it away from Obamacare, and gives what the people of Missouri want, the kind of health care system they deserve. I want to help the needy, not the greedy. And that's exactly what this Missouri solution can be. By reforming these programs, we can incentivize work by helping hardworking families so they don't have to choose between eligibility for their medical treatments and working. The Missouri solution, designed with free market principles, can reward the values of hard work, self-sufficiency, and personal responsibility, not punish them, which the current system too often does. A Missouri solution can move forward without adding new folks to Missouri Health Net, Remote Health Net. Also, a Missouri solution will ensure Missouri tax dollars are spent improving our health care system, not paying for health care for other states. And if Missouri sits on the sideline and chooses not to act, that's exactly what will happen. This is an important point. Listen, I know people don't like taxes, and that's why throughout my career I voted for tax cuts and small budgets. But I also don't like the idea of Missouri tax dollars being sent to fund priorities in other states, which is why once the budget was set, whether it was in Washington, D.C. or even in Jefferson City, but mostly in Washington, D.C., I fought tooth and nail for every dollar that we could get coming back to Missouri to make sure it was well spent. And with the help of many of you, we did spend a few dollars that way. But that's what I'm doing right now. You see, if Missouri sacrifices the billions in federal dollars for Missouri Medicaid reform, Missourians won't be getting a special refund check in the mail. The aid and assistance will be going to other states instead. They'll be subsidizing health care in states like New York or California. If our policymakers do the right thing and pass a Missouri solution that puts Missouri dollars to work for Missourians, it won't cost our state one more penny. That's what I mean when I said that won't cost us anything in general revenue. The federal government will pay the full cost of coverage for 3 years and 90% thereafter, resulting in as much as $2 billion in additional federal dollars for Missouri each year. Missouri can't afford to leave $2 billion a year on the table. These dollars are critical to combating the costly Obamacare cuts that are already hitting our health care providers. Now, what's a Missouri solution look like? Well, there's an ongoing effort. We're working with the legislature and the chamber and other concerned groups and individuals to develop innovative free market reforms, many of which Missouri legislators have already introduced. For example, there are specific reforms that will encourage personal responsibility, healthy behaviors, require higher enrollee cost sharing, like requiring co-pays and charging premiums. There are specific reforms to inject the private sector solutions into Medicaid systems, such as piloting health savings accounts and other activities. Other reforms can root out waste, fraud, and abuse, and increase transparency for both consumers and taxpayers. Of course, my fellow Republicans and I know that reform to protect our budgets and Missouri taxpayers are top priorities. Also, I wasn't born yesterday, so I'm not proposing that Missouri just take the federal government's word for it that they will foot the bill. I'm not proposing Missouri rely on rosy projections and studies no one believes. Instead, there are common sense, dramatic reforms that will ensure not one more Missouri taxpayer dollar is spent on Medicaid reform. For example, we could put in place a circuit breaker to protect our state if the federal government doesn't hold up its end of the bargain. Next, we can put in place a provision that will take the savings Missouri will get from shifting premiums onto the federal rolls in the first several years and putting it in a budget protection fund that will be available if numbers turn south in a bad year in the future. These are just two examples of the innovative reforms that are being discussed and are being worked by Missouri legislators to protect the health care and safety net while protecting taxpayers. In closing, let me emphasize again, this issue is just too important for us not to get directly involved. The Obamacare cuts are the greatest threat to our health care safety net I've seen in my career. The only way to confront these costly cuts is to pass a common sense Missouri reform and solution. I urge all of you to go home and talk with your legislators. Tell them how important it is. If you're here today and if you're here in town this week, talk to them and tell them what it means in your community. Because from what I've heard from you all already, you know what the impact is. Tell your legislators that. Tell them there's a way. We can reform Medicaid. We can get the additional coverage, and we can do it without hitting our general revenue budget. And we can do it in ways that make common sense, market-based solutions to the healthcare needs of Missouri. Thank you for joining with us in this effort. We look forward to working with you. It's a battle that we have to fight and we cannot lose. Thank you very much.